options for cancer include surgery, radiation therapy, chemotherapy, and hormone therapy. There are several surgical options depending on the severity of the cancer. A lumpectomy removes the tumor and a small amount of neighboring tissue. Mastectomies involve removing the entire breast and its tissues. Sentinel lymph node removal is typically performed in addition to lumpectomies and mastectomies. Here, your surgeon will remove the lymph node closest to the tumor and check it for the presence of cancer cells. If this node is clean, it may not be necessary to remove more lymph nodes. A prophylactic mastectomy is a preventative surgery for high-risk women that removes the entire breast to lower the risk of breast cancer. Radiation therapy uses high-energy X-rays or other types of radiation to kill the cancer cells or to keep them from growing. Internal radiation therapy can be used to treat the cancer from the inside of the body with needles, wires, or catheters. Chemotherapy is a treatment that uses drugs to stop the growth of cancer cells by either killing them or inhibiting their cell division. Once the drugs enter the bloodstream, they can travel and reach cancer cells throughout the body. Some types of breast cancers need hormones in order to grow and spread. Hormone therapy works by blocking the cancer cells from receiving the natural hormones that they need. Tests can show if your breast tumor has these receptors and if it is a good treatment option.
A breast biopsy usually is performed to determine if an abnormal area or lump in your breast is cancerous. In this procedure, a tissue sample of the area of concern is removed so it can be examined by a pathologist. Breast biopsy may involve one of three main techniques: fine needle aspiration biopsy, core needle biopsy, or surgical biopsy. Your doctor will choose the technique that best fits your situation. During a fine needle aspiration biopsy, your doctor will insert a needle into your breast. Some form of guidance, such as an ultrasound probe, will be used to guide the needle to the correct area. Then, fluid or a small sample of tissue will be removed. A core needle biopsy is done to remove several small pieces of tissue, or cores of tissue, from the breast. It may be guided using one of several techniques. During a stereotactic core needle biopsy, you will lie face down on a table with your breast inserted through a hole in the table. Your doctor will inject a local anesthetic to numb the area. Then, using a digital mammogram as a guide, your doctor will insert a hollow needle into the area of concern. Several small cylinders of tissue will be removed for examination. During an ultrasound-guided core needle biopsy, your doctor will use an ultrasound probe to locate the area of concern. A hollow needle will be inserted to remove several cores of tissue. Fine needle aspiration and core needle biopsies involve removing small samples of fluid or tissue using a needle. However, if an area of concern detected by mammogram or ultrasound is not accessible by a core needle biopsy, or if your physician wants to remove the entire area, a surgical biopsy may be recommended. A surgical biopsy is done in an operating room using two techniques: excisional biopsy and incisional biopsy. During an excisional biopsy, your surgeon will make an incision in the breast. and remove the entire mass. At the end of the procedure, the incision will be closed. Your surgeon will perform an incisional biopsy if only a small part of the area of concern needs to be removed, usually to make a diagnosis. At the end of the procedure, the incision will be closed. If the abnormality cannot be felt, needle localization will be used to mark the location of the area of concern. During this procedure, your radiologist will insert a hook wire into the breast through a needle under mammogram or ultrasound guidance in order to mark the area. The needle will be removed, but the wire will stay in place. You will then go to the operating room, where your surgeon will make an incision in the breast. He or she will follow the wire to locate the targeted area, then remove it. An X-ray will be taken of your breast to make sure the targeted area has been removed. Then your surgeon will close the incision. Surgical removal of the tumor is part of the treatment for the majority of breast cancers. There are a number of surgical options. Your doctor will help you decide which is best for your situation. In addition to surgery on the breast, it may be necessary to remove some or all of the lymph nodes under your arm. There are two main surgical procedures for breast cancer. The first is breast-conserving surgery or lumpectomy, which is always coupled with radiation treatment. The second is mastectomy, which is removal of the entire breast. It may be combined with breast reconstruction surgery. In both procedures, it may be necessary to remove some lymph nodes. A lumpectomy preserves the appearance of the breast. The tumor, along with a margin of surrounding normal breast tissue, is removed. In this procedure, your surgeon will make an incision in the skin and remove the tumor with a margin of healthy tissue. It will be sent to a pathologist for examination to make sure there is no cancer in the surrounding margin of tissue. The wound will be closed with sutures. In a mastectomy, the entire breast is removed. In a simple mastectomy, only the breast tissue is removed. Your surgeon will begin by making an incision to remove an oval of skin, including the nipple. The breast tissue will be separated from the skin as well as the underlying muscle and removed for examination. Finally, your surgeon will insert drains to prevent fluid collection. A modified radical mastectomy is a procedure where your breast tissue is removed, along with some or all of the lymph nodes under your arm. A sentinel lymph node biopsy is typically performed in addition to a lumpectomy or a mastectomy. It may be done if a clinical exam or imaging study shows no evidence that cancer has spread to the lymph nodes. The purpose of the biopsy is to identify and check the first draining lymph nodes from the breast to make sure cancer hasn't spread there. To do this, dye will be injected into your breast to determine which lymph nodes are the sentinel lymph nodes. Your surgeon will remove 1 to 3 sentinel lymph nodes for examination. If these nodes have no cancer, it is unlikely other lymph nodes have cancer. If these lymph nodes have cancer, the rest of the lymph nodes under your arm, called axillary lymph nodes, may also have cancer. In this case, a complete axillary lymph node dissection may be recommended to remove most of the nodes in this area. An additional option in the case of a mastectomy is reconstruction of the removed breast. breast reconstruction makes use of implants or tissue from other parts of the body, such as the abdomen or buttocks, to create a new breast. In some cases, the surgeon is able to also preserve the nipple. The reconstruction can be performed right after a mastectomy, known as immediate reconstruction, or at a later date, called delayed reconstruction. If you are considering reconstructive surgery, your doctor can help you decide what approach is best for your situation. A mammogram procedure uses low-dose X-rays to view and detect changes in breast tissue. A woman's breasts are composed of glandular tissue and ducts, fat, connective tissue, and blood vessels. A mammogram is a routine X-ray screening test for women over the age of 40, or for those with breast-related symptoms such as a lump or nipple discharge. Before your mammogram, make sure that your breasts and underarms are clean, and do not wear deodorant since it may appear on mammogram X-rays as calcium spots. A screening mammogram is performed yearly as a routine study for women over 40 when there are no symptoms related to the breast. A technician will begin by placing one of your breasts between two specialized plates. The plates will compress to flatten your breast so that the camera can get clear pictures of your breast tissue. You may feel some discomfort during the compression, but it will only last a few seconds. Then you will change position for a second picture, which will be taken from the side. This procedure will then be repeated on your other breast. You will get the results from your screening mammogram later, usually within a couple of weeks. A diagnostic mammogram is performed if a screening mammogram shows an abnormality or if there are symptoms such as a breast lump or nipple discharge. During a diagnostic mammogram, X-ray images are taken from different views, and an ultrasound may be performed. You will get the results from your diagnostic mammogram during your visit to determine the next steps.
The staging of breast cancer refers to the extent of the disease. The cancer stage is based on several factors, including the size of the tumor, if any lymph nodes are involved, if the cancer is invasive or non-invasive, and if the cancer has spread to areas beyond the breast. Stage 0 is considered a non-invasive breast cancer. In this stage, there is no evidence that the cancer cells have spread into neighboring breast tissue beyond the duct or lobule. Stage 1 is considered an early stage of invasive breast cancer. When measured, the tumor is no more than 2 centimeters in diameter, and there is no evidence that the cancer cells have spread beyond the breast. Stage 2 is divided into subcategories of 2A and 2B. Stage 2A is invasive breast cancer, where the tumor is either a maximum of 2 centimeters in diameter and has spread to the lymph nodes under the arm, or the tumor is between 2 and 5 centimeters in diameter but has not spread to any lymph nodes. Stage 2B is a little different in that the tumor is either between 2 and 5 centimeters and has spread to underarm lymph nodes, or the tumor is larger than 5 centimeters but has not spread to the underarm lymph nodes. Stage 3 is considered a locally advanced cancer, and it is also divided into subcategories of 3A, 3B, and 3C. There are 2 main scenarios that can occur with stage 3A breast cancer. 1, where the tumor is no larger than 5 centimeters in diameter, but it has spread to underarm lymph nodes that are growing into each other, forming clumps. The cancer may also have spread to the lymph nodes near the breastbone. The second scenario for stage 3A is very similar, with the exception that the tumor is larger than 5 centimeters in diameter and that the underarm lymph nodes are not adhered to one another or other tissues. Unlike the other stages, in stage 3B, the tumor may be any size and has spread into the skin of the breast or chest wall. This stage may also include lumps in the skin of the breast or swelling of the breast. In stage 3C, the tumor may also be of any size, but it has also spread to lymph node areas above or below the clavicle, the chest wall, and/or the skin of the breast. Stage 4 is considered distant metastatic cancer, meaning the cancer has spread to other organs and parts of the body. Surgical removal of the tumor is a common treatment for breast cancer. There are a number of surgical techniques, and your doctor will help you decide which is best for your situation. In addition to removing your breast tissue, it may be necessary to remove some or all of the lymph nodes under your arm. Before the procedure, an intravenous line will be started, and you may be given an oral sedative to help you relax. Breast surgery usually requires general anesthesia. A breathing tube will be inserted through your mouth and into your throat, and you will be given medications to put you to sleep for the duration of the procedure. Depending on the type of procedure, breast cancer surgery usually takes 1 to 3 hours. The main surgical procedures are lumpectomy and mastectomy. A lumpectomy preserves the appearance of the breast. The tumor, along with a margin of surrounding tissue, is removed. In this procedure, your surgeon will make an incision in the skin and separate the tumor and a margin of healthy tissue from the breast with a scalpel. Then your surgeon will remove the mass with forceps, send it to the pathology lab for examination, and close the wound with sutures. In a mastectomy, the entire breast is removed. This is usually indicated when the tumor is too large for a lumpectomy. In a simple mastectomy, only your breast tissue is removed. Your surgeon will begin by making an incision around your nipple. He or she will then separate your breast tissue from the muscle underneath and remove it for examination. Finally, your surgeon will insert drains to prevent fluid collection before closing the wound. The most common type of mastectomy is a modified radical mastectomy, in which the entire breast and some or all of the lymph nodes under your arm are removed. In this procedure, your surgeon will make an incision along the length of your breast, separate your breast tissue from the muscle underneath, and remove it for examination. To remove the lymph nodes under your arm, many surgeons use a technique called sentinel node biopsy. In this procedure, dye is injected into your breast to determine which lymph nodes drain fluid first. It is these lymph nodes that are most likely to contain cancer. Your surgeon will remove 1 to 3 of these lymph nodes for examination, insert drains, and close the wound with sutures. In a radical mastectomy, the breast, underlying tissue, muscle beneath the breast, and all visible lymph nodes are all removed. Your surgeon will begin by making an incision along the length of the breast. Next, he or she will separate all of the breast tissue, muscle from the chest wall, and visible lymph nodes, and remove them for examination. Finally, your surgeon will insert drains before closing the wound. After your breast surgery, your breathing tube will be removed,
and you will be taken to the recovery area for monitoring. Lumpectomies are often done as outpatient procedures. In this case, you will be able to leave the hospital after several hours. If your surgery is done as an inpatient, your doctor will generally have you remain in the hospital for 1 to 2 days to monitor your recovery.
You or someone you care about may have been recently diagnosed with breast cancer. This video will help you understand some available treatment options. Breast cancer is a disease where some of the cells in the breast begin to grow uncontrollably. Treatments for breast cancer can include surgery, radiation therapy, chemotherapy, hormone therapy, targeted therapy, and immunotherapy. There are several types of surgery depending on the size and location of the tumor. This video does not cover all available types of breast cancer surgery. During a lumpectomy, the tumor is removed along with some of the normal tissue around it. In a total or simple mastectomy, the entire breast is removed. During a modified radical mastectomy, the entire breast is removed. In addition, some of the lymph nodes under your arm are removed and sometimes other tissues in your chest. Your doctor may also want to give you radiation therapy. This therapy uses radiation to kill the cancer cells or keep them from growing. External beam radiation uses a machine outside the body that aims radiation at the cancer. Internal radiation therapy, also known as brachytherapy, uses a substance that gives off radiation through different types of delivery devices. The substance is put inside your breast where the cancer has been removed. Chemotherapy uses certain drugs to kill cancer. These drugs may treat cancer cells throughout the whole body or can be given to treat cancer cells in one area. Another treatment option is hormone therapy. Hormones are substances found naturally in your body. Estrogen is one of these hormones. Your body uses estrogen mainly for the growth and development of your uterus, breast, and ovaries. However, estrogen can also promote the growth of certain hormone receptor-positive cancer cells. One type of hormone therapy blocks estrogen from binding to breast cancer cells so it cannot cause cancer cells to grow and divide. Targeted therapy is a treatment option for cancers that have a specific kind of marker on the cancer cells. One therapy targets cells with markers called HER2. HER2 is a naturally occurring protein on your cells that normally promotes healthy growth in your cells. Some cancer cells have too much of this protein. This causes the cancer cells to grow and spread more aggressively than normal cells. Targeted therapy drugs are designed to only attach to the HER2 proteins on cancer cells. As a result, the cancer cells stop growing and may die. Immuno-oncology, also known as immunotherapy, helps your immune system fight cancer. Cancer can sometimes hide from the immune cells that attack them. For example, both cancer and immune cells may have proteins called checkpoint proteins. When they attach, attack from other immune cells is stopped. Scientists are looking at one type of immunotherapy drug that blocks the checkpoint proteins from attaching to each other. As a result, the immune cell can attack and destroy the cancer cell. Your doctor may prescribe a combination of the treatments we've discussed or different treatment options than those mentioned here. If you have questions about breast cancer or any medications you have been prescribed, talk to your doctor. It is important to take your medications as directed and report any side effects you have.
Treatment options for cancer include surgery, radiation therapy, and chemotherapy. You may receive one or a combination of these treatments, depending on the size of tumor, whether it has spread, and whether or not you would like to be able to have children. You have several surgical options, depending on the type and stage of the cancer. During early stage 1A, your surgeon may perform conization to remove a cone-shaped piece of the cervix. One example of conization, called LEEP, or loop electrosurgical excision procedure, uses a thin wire heated by electricity to remove the tissue. During later stage 1A and 1B, your surgeon may perform a radical trachelectomy to preserve your uterus if you want to be able to have children later. The surgeon removes the cervix and upper part of the vagina and places a stitch at the lower end of the uterus to act as an artificial internal opening of the cervix. During early stage 1A, your surgeon may perform a total hysterectomy, removing the uterus and cervix. During later stage 1A and 1B, your surgeon may perform a radical hysterectomy, removing the cervix, the tissue around the cervix, the uterus, and part of the vagina. During either a total or radical hysterectomy, your surgeon may remove other tissues, such as the fallopian tubes, ovaries, or lymph nodes as necessary. If the cancer recurs, your surgeon may perform pelvic exenteration, removing all the organs and tissues as in a radical hysterectomy, plus the pelvic lymph nodes, bladder, vagina, rectum, and colon, depending on where cancer has spread. Radiation therapy, or radiotherapy, uses high-energy rays to kill cancer cells in the treated area only. External beam radiation therapy is directed at the cancer's location from a machine outside your body. Brachytherapy, or internal radiation therapy, is directed at the cancer's location from a device placed inside your body. Chemotherapy, a systemic treatment, uses drugs to stop the growth of the cancer cells by either killing them or inhibiting their cell division. Once the drugs enter the bloodstream, they can travel and reach cancer cells throughout the body.